Next up, we have Mountain State Health Alliance.
We're Team Mountain States Health Alliance presenting our solution, DrugCaster. DrugCaster reduces the percent of overdoses that result in death through the use of real-time crime data in conjunction with overdose tracking. The focus is to provide a single but comprehensive monitoring and response tool accessible via web and mobile. It will leverage existing same and next-day data sources. The benefits are that it provides immediate visibility into drug and crime-related activity. It also aggregates multiple sources into a single cloud-based database. It correlates crime and drug use data to enable forecasting by neighborhood. And the intended audience is public health officials with Richmond as our pilot.
Well, we certainly face the same challenges as everyone with the granularity of the data and bringing the various pieces together. As we brought our crime data together and started to look at health indicators in it, we were able to see some elements coming out. For example, on the left here, you're seeing for crime and drug use from the beginning of the year by day of week. You can see that Thursday, Friday, Saturday, for whatever reasons are driving that, twice the incidence rate as a percent of total crime are related to drug activity than on other days. If you look at day of the month, you see spikes about the 5th day and the 20th day. We postulate these are probably related to 1st and 15th day payments and benefit refresh. So there's some elements there that could help drive risk modeling in this kind of challenging data environment. So we took what we had and we created a prototype of our application, which will be upgraded to version 10.4 at the end. Back one page. So what we have here is, again, focusing on Richmond initially as our proof of concept, looking at crime data from the beginning of the year forward, and we'll animate this running by day starting in January going forward. Circles indicate the volume of crime activity. Deeper red indicates higher percent of that crime related to drug events. Lighter, the background that provided by Tableau here is based on median income. So you see your central Richmond and your less affluent neighborhoods, maybe your suspected hotspots initially, but you see some areas outside of that range as well where you're seeing activity. Our goal really is to try to use this data to inform community health workers on where they need trainees, where they need Narcan, where do you need to have supplies and trained professionals to meet these demands? And can we use the crime data to be an early warning system for areas such as, if we look up here at this bright red up here, maybe this is an area where it hasn't been a focus. So looking at the next slide, oops, back one. Where'd you go to? There we go. So this is the treatment data we had received this morning of treatment facilities. Certainly there are no treatments out that far. So there, again, there's a gap here potentially. We also have an interest in getting trainee data from the Department of Behavioral Health on, we've seen their volume numbers, but we don't know exactly where their staff are distributed. We'd like to ingest that data as well. Overlay where the trainees are today, where the Narcan's being used. Go back one more time to the first daily crimes. So this ended basically day before yesterday. So this is live data. If we look into Tuckahoe there, sorry if I'm mispronouncing it. There were 4 events in that zip code. One of them was an overdose. We can see the address related to that. We can know exactly which neighborhoods, which streets are presenting those new hotspots, and we can match that with our resources and hopefully, as Danielle described, assist in reducing the rate of deaths from those overdoses by having the right people and the right supplies in place.
The DrugCaster depends on connectivity with existing data sources. Some of these data sources are ODMAP and police reports. We also would like access to a list of area responders and active participation from all parties. Clear enhancements include HIE integration as a source of overdose data determined by the trigger drug naloxone, or commonly Narcan, administration in the facilities. It will produce better risk profiling as a correlation of other factors. Also, collaboration with Revive